This video describes the placement of a simple intracranial pressure monitor. Measure landmarks, generally from 10 centimeters posterior from the glabella, 3 centimeters lateral from midline, placing your incision in front of the coronal suture. After prepping and draping in the usual sterile fashion, infuse a small amount of lidocaine at the site of your incision. Make a 1 centimeter long incision into the scalp. Next, place your drill in the incision perpendicular to the bone. Use your non-dominant hand to support the drill and your dominant hand to drive the drill in a quick fashion. As you drill, important points to remember are that you will encounter dense cortical bone at the outer table, followed by cancellous bone, and then another dense layer of cortical bone on the inner table. As you transition from cancellous bone to cortical bone of the inner table, you will receive tactile feedback that you're in denser bone. Use that as your clue to then lessen your downward pressure and prevent plunging into the brain. You may need to drive the drill by hand close to the drill bit when you're in this layer, as the drill may catch and stop intermittently as it travels through that denser cortical bone. Once you're through the inner table, take a hypodermic needle or a stylet and puncture the dura, and then secure your bolt down to the skull.
Good. Take this out.
Next, remove the stylet from the bolt, and then refer to your manufacturer's instructions for calibration of your ICP monitor, which must be done outside of the skull. Once you're sufficiently calibrated, as this monitor will indicate an ICP of 0 outside of the skull. Next, secure the probe to the bolt and then check your reading, ensuring that there is an adequate waveform. This video is intended for general educational purposes only and does not replace direct supervised training. Please follow the specific instructions provided by the manufacturer of the ICP monitor at your institution.